Hello, and welcome to the Encore Research Group podcast, where we encourage community research and education with weekly podcasts. I'm your host, Benton Loeyball, and this week we're talking about rheumatoid arthritis. Room for improvement, tackling rheumatoid arthritis. Rheumatoid arthritis is a chronic, incurable autoimmune inflammatory disease that affects several joints at the same time. Around 1% of all adults have rheumatoid arthritis, and onset is usually between the ages of 30 to 50. It affects mostly women. As stated above, rheumatoid arthritis is an autoimmune disease. Auto meaning self, and immune referring to the immune system that fights off invaders and infections. Healthy tissue is attacked by the immune system, causing pain, stiffness, swelling, deformities, and reduced mobility through inflammation. These symptoms can lead to serious complications, including joint damage, destruction of the bones, damage to other organs, anxiety, and depression. Over time, rheumatoid arthritis gets worse, leading to drastically reduced quality of life for many patients. Now let's crack our knuckles and get into the weeds of how this works. Before we pick our way through rheumatoid arthritis, let's open the lid on what a joint is. Joints are where bones meet and allow movement. A little cavity around the bones is filled with a lubricating fluid called synovium that's kept inside an external bag-like tissue called the stratum fibrosum. Cells are few in number here, usually macrophagic cells that clean up the fluid and fibroblast-like cells that make the fluid and cartilage of the joint. When other cells, especially immune cells, get in, rheumatoid arthritis can occur. The exact cause of rheumatoid arthritis is unknown, but genetic factors, environmental factors, and randomness play a part. Smoking, silica dust, diet, and infections are among the environmental factors. The microbiome may also play a role, but this is a new science and is still being investigated. Regardless of the cause, the body starts identifying healthy joint tissue as a potential invaders. B cells and T cells are activated by immune cells, which invade the synovium and stratum fibrosum. These cause inflammation, release dangerous enzymes, and activate bone-degrading cells. The macrophage and fibroblast-like cells start going haywire as well, secreting enzymes and building stiff, fibrous material where the lubricating synovium should be. The end result is swollen, damaged, painful joints that don't function very well. So what can we do? Unfortunately, there are no cures for rheumatoid arthritis. But luckily, there are many types of treatments that may provide some relief. The first steps are those which require no medication: a diet rich in polyunsaturated fats, sleep, occupational therapy, physical exercise, and surgery may decrease pain, depression, and anxiety while increasing mobility. Medications can also provide significant relief. Anti-inflammatory medications, including NSAIDs like ibuprofen and glucocorticoids like hydrocortisone, target the end product inflammation. Disease-modifying anti-rheumatic drugs, or DMARDs, target parts of the immune system to prevent destruction and inflammation. T or B cells, inflammatory signaling molecules, or other parts of the system may be targeted by these medications. Different people tolerate each of these medications differently, and they all come with their own drawbacks. New mechanisms are being investigated that mimic the systems in the body that regulate inflammation in rheumatoid arthritis. With the help of remarkable volunteers in clinical trials, these medications may one day come to market and provide relief to joints that sorely need it. Thanks for joining us on this week's episode. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at encoredocs.com. That's ENCOREDOCS.com. Encore Research Group has been involved in clinical research for over 25 years. We have 7 clinical research sites across Florida, including 2 Phase 1 units. If you're in Florida, join us at sites in Northeast Florida and on the Nature Coast. If you're outside of Florida or South Georgia and are interested in joining a clinical trial, head over to clinicaltrials.gov. For more great content, including discussions by physicians and clinical research experts, check out the MedEvidence podcast. My name is Benton. Thank you for joining, and we'll see you next week.